Hi, welcome to Unveiling Sickle Cell Beyond the Pain. I am your host, Tabitha McGee, and the Executive Director of the Sickle Cell Foundation of Georgia. I have learned over the years how important it is to prioritize your mental health as well as your physical health. Today, we're going to talk to the experts about how important mental wellness is. It all starts here, and it all starts right now.
I know the questions in your mind. Unveiling sickle cell beyond the pain. Now I believe that I can get through anything. Past the touch, now you can unveil sickle cell beyond the pain.
Welcome to Unveiling Sickle Cell Beyond the Pain. How often have you thought, wow, I really need a mental health break? Well, imagine what it's like for people with sickle cell disease and living with chronic pain daily. Our guests today are well equipped to help with strategies for maintaining good mental health. Dr. Katrina Wilcox is a licensed professional right here in Georgia. Clayton Andrews is a licensed professional counselor as well. He is also a sickle cell warrior and a husband and father of 7. Welcome to both of you today. I'm so excited for you to join us. So we're going to go ahead and jump right in with you, Clayton. So please tell me, why did you decide to specialize in mental health and sickle cell?
I think the best answer I can give is just lived experience, living with sickle cell, living with not only the physical symptoms, but the mental health consequences, I guess I can say, of the experiences as well. It gave me an interest into just kind of the feelings and the thoughts that a lot of us go through, that we have the invisible pain already as it is, and then even in more unseen mental complications. And so it's always given me an interest in working with people like me who live with this experience and finding ways to best live and cope and strive through it.
That's a wonderful reason why you decided to specialize in sickle cell for sure, being a warrior yourself. And I know that you've helped so many warriors, so I'm really thankful that they have you. So Katrina, tell me about you. Tell me, same thing I asked, Clayton, why did you decide to go into this practice? What was your reason? What was your motivator?
Yes, for me, I've always found myself in this space. I graduated with a master's in clinical mental health counseling, and I found myself doing therapy before therapy, so I went and got the credentials. I've also seen clients with lupus, cancer and lupus at the same time. And what I've known is that pain is almost the same, but for different individuals. And so I think emotional support is needed in the medical community as well as the mental health community, so the person will have somewhere in a safe space to go for their emotional needs.
Wow.
Yeah.
So both of you guys have said something, sickle cell doesn't have a look, right? Mm-hmm. You can't look at someone and tell that they have sickle cell because you look handsome, Mm-hmm. I can't look at you and tell.
Right.
And then when you start talking about the mental aspect of it, you can't see that as well. So many people that are broken and really need mental health counseling, they don't say anything. They're very strong. They don't want anyone to know that I'm at my breaking point. So how do we make people feel comfortable, particularly because, as you guys know, in the African American community, it's a stigma of mental health counseling, mental health therapy. I don't want to go through a therapist. So what have you both done to make people feel that, it's okay to have a therapist? I even have a therapist. I think it's so incredible. Right. You need a therapist.
Yes.
So Clayton, let's start with you.
I believe in full transparency, being able to say, hey, I have had this condition, I've had these experiences, and even I know there are areas that I have to gain support, and being able to encourage others to say, hey, okay, I need this support too. I need the kind of help that I might not be getting from my physician or from my primary doctor or my hematologist. There are the needs that are a little bit more extreme that I'm going through that I want to have that help in. And so I believe in being transparent and saying, hey, this is something that I'm dealing with. The struggle, yes, is absolutely real, but it's not impossible. And, just being encouraging and being genuine.
Right. That's important. Transparency and being honest is so truly important. That's how you gain more people to come to you. So, Katrina, I want to ask you, the same question I asked, Clayton.
Sure. When you have a patient that's dealing with a chronic illness, asking them and finding out the reason they don't want to seek the help, what's going on with them. It may be embarrassment, it may be shame, it may be no one will understand what I'm going through. But as a mental health clinician, making that person feel very comfortable to know that it's okay to talk about it. It's okay not to be okay. If you need to help, it's okay to seek the help. That's why a person like myself or Clayton, we're trained in these areas to help them give that support to them. And the most important thing is making them know it's all right. It's going to be okay, providing some type of hope to relax them. Sometimes people are tense, sometimes people are afraid. Are they really going to understand me? Do they really care about me?
Wow.
So providing that safe space so they can have open dialogue is very important.
You said a lot there. It is very important, to have that safe place. It is very important for you guys to be skilled and trained in this area so you can bring and draw more people into you that need you all. I noticed that there's so many sickle cell warriors are already suffering because chronic pain by itself, I can't even imagine being in pain every single day. I think about this time I had this toothache, and I think I got the toothache on a Friday or something. Dentist was closed. It was unbearable pain. And then to try to put myself in the shoes of a warrior that's dealing with this almost daily, every other day, I can understand why mental health is so important. So let me just ask you, Clayton, what are the new advancements that we have available on the market inside of mental health?
I think just one of the advancements is really just acknowledging that the care exists.
Oh, okay.
For a long time, it's always been about the physical aspects and the physical consequences of sickle cell, which are very real. But we've never had a chance to really touch on what are those emotional, social cues and those psychological effects that come along with experiencing that. Just growing up, there have been times where I've gone to the hospital and you've had to wait while in pain, or you've had to answer certain questions while in pain, or there's almost an inquisition as to what your motives are. So now you're feeling pain, you're feeling anxiety, you might be feeling anger, you might be feeling embarrassment, you might be all these different feelings, but we're still just managing the pain. So now there's, with this awareness of, hey, there is this other element when it comes to this disease of being able to work on it. I think that's a huge advancement in and of itself. The sanctuary.
Yes.
The sanctuary. I am very grateful for just this opening and being another part of another resource, a very significant resource, and just saying, hey, not only is there mental health care, there's these other elements that can help foster your care with living with this disease.
Ambiance is so important. And so when you first walk into the sanctuary doors, I wanted them to feel that you're in a safe place. I wanted them to feel that you're with people that really care about you. So thank you for mentioning that, because the sanctuary is bringing a lot of our warriors out and we're so excited about it. So let me just ask you very quickly, before we go to break, Katrina, how are you dealing with people that, not with just one illness, you talked about cancer and lupus. So give me just a quick overview of that.
Yes, first you have to meet the person where they are. You have to assess the pain. You have to also ask questions about medical help, how they're doing, meet them where they are. If they're having a bad day or a good day, sitting with them in that, not rushing the process, and letting them know it's okay. Also, too, asking them, are you taking your medications? How are you eating? How are you sleeping? A lot of times there's depression, there's anxiety, it's so much going on. And when you mentioned the sanctuary, even encouraging them when they set up their atmosphere at home. I'll give you an example. When they go to sleep, I said, set it up like a spa. Have your light dim. Have a diffuser there in the room. Put on some soft music so you can relax. Let's do some breathing exercises because it quiets the nervous system. Let's focus on the breath. So certain strategies, even if you're able to do some yoga, nothing too intense. And being okay with not being okay, but also realizing your normal is different. Right? Whatever that may look like.
Yeah.
And when you mentioned the sanctuary, I thought that was a beautiful thing because atmosphere is everything. It changes the mood. It encourages you. Like, okay, I'm accepted here. I'm okay to be here.
Exactly.
This is an environment for me. They can come in one way, but once they leave the sanctuary, they're a totally different person.
Right. Well, thank you both. Great information that you're sharing. We're going to hold that thought. We're going to go to commercial break, and we'll be right back. So don't you go away. The next guest joining us to talk about mental health wellness is Dr. Otis Powell. He's a board-certified family practice specialist in Atlanta and is currently the medical director right here at the Sickle Cell Foundation of Georgia. And I am so excited, Dr. Powell, that you are here.
Thank
You
you.
are a legend.
I don't know. Well, I'm just in the community working, that's all.
It's more than being in the community working. I mean, after 30 plus years in the community, our Sickle Cell Warriors absolutely love you. And I first want to say just thank you for being there for them. And particularly in this capacity of mental health, because there are so many challenges. And so I want to start off by just asking you, a little bit more about your background and why did you decide to specialize in sickle cell and mental health?
Well, I'm a family physician by training. Part of our training does involve mental health.
Okay.
Unfortunately, and a lot of primary care physicians get out, they don't get involved in mental health like they should. But I've always had an interest in mental health through the years. But I've also had the opportunity to work in a mental health clinic.
Okay.
I work in a mental health facility in one of the counties here in Metro Atlanta. I've been doing that for about 14 years now.
Okay.
So it's heightened my appreciation and awareness of how important mental health is in health and wellness.
So when you think about mental health and you're saying how important it is it because the clients are living in chronic pain that you think this is so necessary for them?
Well, chronic pain, we know, and I work with a lot of students and residents, and we always emphasize to them that chronic pain can lead to mental illness,
Okay.
especially depression, and other more serious issues with chronic pain around suicide. But we always emphasizing the importance of doing mental health as a preventive measure because we're dealing with patients with sickle cell disease, and chronic pain can be extremely debilitating and extremely stressful on your mental state.
So you had mentioned earlier that, some other doctors don't really go into the mental health space like they should. Is there a particular reason for it?
Well, mental health is something that you want to do, and the perception is that mental health requires a lot of time. The average primary care doctor is extremely busy seeing patients and feel they may not have that time. But I work with a team, myself and therapists, and the ideal situation is for you to have a physician that's doing medication management and a therapist that's requiring therapy, and then the physician or provider can do some therapy as they feel the need to. But a team approach is probably the best way to handle this.
How do you as a provider integrate mental health care into the regular health care plan that you prescribe to your patients?
Well, it sort of it comes natural to me, just having an appreciation of how important mental health is in healthcare. We know that those with mental illness die a lot sooner than those without mental illness. I think you may take 10 years off your life because you have a mental illness, so you're preoccupied with that problem, that mental problem, and you may pay less attention to your physical well-being and the other chronic illnesses that you might have. So it's extremely important now to integrate mental illness into primary care. That's the ideal setting.
Okay.
You can get better outcomes if you you're looking at the mental problems and the physical problems and chronic illnesses at the same time.
So, you know, in the community, African American community, mental health therapy, therapists, psychiatrists have been frowned upon for so long. I know more women probably are open to get mental health counseling, but what do you do as an African American doctor, as a male doctor, to get more men to accept mental health, help?
Well, first you have to help the men become more comfortable with talking to you.
Okay.
That's the primary thing, and then you gradually discuss a mental health, not as some serious problem, but as a situations or states that we all deal with at some time in our lives. So having mental illness, are you feeling you have a mental illness, shouldn't stop you from discussing it with someone.
Okay.
But I think making patients more comfortable talking to you goes a long way, and we try to encourage men to get more involved in mental health. That it's get away from this macho thing about I can't discuss if I discuss mental health, that means I'm weak and all these type things. So we try to dispel a lot of those things. You're actually being strong by discussing mental health.
Absolutely. Dr. Powell, I tell you, you just bring so much to the community. The Sickle Cell Warriors love you. You've been around for a very, very long time, and I'm really excited that you're here today, to really discuss this, because I think this all by itself is going to open up so many more, particularly men, and individuals in our community to understand that it's okay. I have a therapist. And I was like, I never knew I needed one until I knew I needed one. And so you being here today, providing insight is very important. So I just want to say thank you for that. Then I want to end on this note of what advancements do you see inside the mental health community, or the mental health space, should I say, that we can look forward to in the future?
Well, I think the advancements is helping to educate, especially the African American community, on the importance of seeking help for mental health. There are a lot of advances in treatment and in medications and so forth, but the biggest advance we can make is to get people to feel more comfortable in discussing mental health and not look at it as some type of stigma.
Okay.
Then after that, we can, we have things available that can be extremely helpful. We got to get physicians and providers more comfortable with talking about mental health. And I think we're moving there, but it takes a while.
Okay. Well, thank you. What we're going to do now, we have this amazing guy, Blaze. He's out on the streets in Atlanta with Did You Know? So we're going to look back here and take a look at Blaze. Blaze, how is it going with Did You Know today?
Beautiful day out here. I'm with Brooklyn. And this is Did You Know, the show to test what you know about sickle cell disease. So Brooklyn, do you know anything about sickle cell?
A little bit.
A little bit?
Yeah.
Pequeño, that's what they say? Okay, my bad.
Yeah.
Do you know anyone with sickle cell?
Yes. Not personally, but it was like a friend or like
Friend
an
of a friend.
acquaintance.
Somebody you used to know?
Yeah.
Got you.
Yeah.
Ask you a couple questions. Get them right. Chick-fil-A. You like Chick-fil-A?
I do.
You're not one of those vegetarian people, are you? Okay, cool. Multiple choice.
Okay.
Think about it, right?
I think I got it.
Marinate on it.
Okay.
Question number 1. What populations are most prone to have sickle cell disease?
Okay.
A, people of African descent. B, people of Asian descent. C, people of European descent.
A.
A?
Yeah.
You sure?
Yes.
Okay, A is correct. 2, yeah, clap it up.
Thank you.
2 more questions. Let me find a hard one for you for real.
Oh gosh, not a hard one.
Okay. What other populations are affected by sickle cell disease?
Okay.
It's kind of like what we just asked you, but a different little variation for it. Only people of African descent are affected. B, people of Hispanic, South Asian, Southern European, Middle Eastern ancestry. or C, only people of Asian descent? I'm gonna ask you again because I'm.
Right. I'm gonna
What,
listen.
what other populations are
Right.
affected? Only African people. B, people of Hispanic, South Asian, Southern European, and Middle Eastern ancestry. Or C, only people of Asian.
If I use my critical thinking skills.
Okay, we're using critical thinking. What does that tell us?
B,
B?
because it says other.
We're sorry, that is
populations.
incorrect. I'm sorry. I'm just playing. You got it right, you got it right, you got it right, you got it right, you got it.
Thank you,
Cool.
thank you.
One more.
Okay.
Last question. Ball, chicken. You walking away with chicken sandwich.
Yeah.
That's a little bit before your time. I'm sorry. You wouldn't have got that. How do you know if you have sickle cell disease? A, by a genetic test only available in specialized labs. B, by a simple blood test. C, by a physical exam. So,
B,
by a simple blood test?
because yeah, because when they look at your blood underneath the microscope,
You can tell.
they'll see it.
They can see
This,
that
right.
you got sickle.
Right, like your blood cells ain't the right shape.
Correct.
Period.
Chicken sandwiches, man.
Thank you.
Brooklyn just walked it through the park. Here you are.
Thank
a
you.
golden Chick-fil-A card. You get infinite chicken sandwiches for the rest of your life.
Whoa.
That's not really true, but thank you so much for playing. This
Thank
was
you.
Did You Know, the show to test what you know about sickle cell. Thank you so much, Brooklyn.
Thank you.
We out. Back to you guys in the studio.
Oh, wow, Blaze, thank you so much. Dr. Powell, thank you again so very much. I know that so many people are gonna learn so much from hearing from you today, and I just wanna say thank you for being here.
Thank you.
Another great show, all wrapped up. We got such good, useful information from all of our guests. It can help not only our sickle cell warriors, but anyone striving to maintain good mental health. As always, a big thank you to our sponsors, our supporters, and to you, our faithful viewers. We'll see you again soon next week. And remember, there's hope in every heartbeat.